Hello class. Right now I will be presenting my critical assignments and we'll be discussing the health related topic of spina bifida. I hope you guys enjoy and hello guys, this is my critical assignment, contemporary health related issue of spina bifida. My name is Myasia Gray and I'm going to begin to discuss this health related condition with you guys. Stay tuned. Starting to discuss spina bifida, it's very much a common chronic health condition, which is something that stood out to me. Reading into this, it starts to talk about how young children have reported low health-related quality of life with this particular chronic disorder. Spina bifida, it presents an array of multiple symptoms ranging from mild to severe, and this can be very, very detrimental to a young person's life that possibly doesn't know how to handle these things. So I do get it. I did a lot of research and compiled a lot of research in regards to finding commonalities within symptoms and just breaking down the different forms of spina bifida in order to get a better understanding of how it may affect a person's organs, their abilities, and way of life. Meningocele and oculata is the three forms of spina bifida, which you can see different forms of risk. The first kind, meningocele, presents cognitive and motor function disabilities and impairment, loss in sensation in limbs, affects bladder and bowel functions, and can be the most severe form. Now, getting into meningocele, this is the second most severe form of spina bifida, which presents itself as a sac of fluid, which comes through an opening within the back of a baby's spine. This sac usually presents little to no nerve damage and presents minor disabilities compared to the rest. Now, oculotal usually is the more hidden spina bifida, which presents the least amount of symptoms associated with this kind of spina bifida. When trying to understand the quality of life while undergoing spina bifida, you want to understand the social aspect, mental aspect, medical services that need to be provided, physical health, as well as the medical supplies that are needed in order to survive. Now, multiple studies, even from the Center for Disease Control and Prevention, have provided an abundance of information in regards to how costly medical care can be to improve physical performance and developmental services, as in a nutshell. With this kind of chronic condition, patients can experience some sense of social anxiety, inability or limitation to certain physical movement, a stigma around urine catheterization, and most of the time bullying because of lack of knowledge of this particular disorder. Medical services include any type of surgeries or doctors that you have to come across, including your physical therapist. When getting into the mental aspect, it can be quite a bit to handle when undergoing the pressures of having these symptoms. So I think it's very much important to be aware of these things, which is why I mentioned a bunch of symptoms on the medical aspect, and also different ways you can improve your mental well-being. The current treatments are very important to be aware as well within, your journey of struggling with spina bifida. Various studies have shown that innovative technology has helped with improving function and decreasing the severity of symptoms, which, the first aspect that we would go to would be spinal surgery. With spina bifida, there are multiple levels of care that are required in order to treat this particular condition, which stepping into, myelomeningocele being the most severe, this form actually requires correction to the spinal defect, which means surgery is the main option. Then we get into the devices that, many will use based off of their conditions, that can be very important. Treatments in forms of physical therapy can be helpful, depending on the severity, to determine the, effectiveness in improving physical performance. This could help with, ability to strengthen your muscles, flexibility, maximizing full range of motion, conditioning, coordination, and even balance. All of these things tied together can help you have a better understanding of the resources that are out there, the communities that you can be a part of, and awareness that you can create in order to better this common defect that is targeting a lot of infants, babies, amongst this world. I think one of the main parts to be aware of when discussing these things is that, as things are constantly evolving around us, we must be aware of new innovative systems in order to treat conditions such as spina bifida.